So next we're going to be moving on to the elderly population. So we're looking at how do we basically improve their quality of life? Because at this point, most of them have at least one chronic disease, if not two or three, maybe even four. Maybe they've had some past medical history, some past surgeries like open heart surgery. So this is where it becomes really important as dietitians to work with them nutritionally. A couple things that change for this population is a condition called sarcopenia. So sarcopenia is that excessive loss of muscle and strength, and then this affects their mobility. So if an elderly person is laying in bed all day, then they're at risk for malnutrition, they're at risk for developing wounds, and then if they have wounds, they have an increased risk of infection. So it's so important for us to help these elderly continue that ADL. So ADL stands for activities of daily living. Those include getting dressed, going to the bathroom, being able to cook your food, being able to brush your teeth, something that you can do on a daily basis. It's really important. That's our goal, is to maintain that ADL. Some other functions that start to lower due to just being used all these years. If somebody's 80 years old, their body has been working so hard for them all day, every day of their lives. We've seen their decreased kidney function, so their function of their kidneys start to lower and not be as effective. Brittle bone, osteoporosis. So osteoporosis is when you have very brittle bone, and if you fall, you're very easily breaking bones, especially hips. When we look at this older population, hip fractures are very, very challenging. Most likely, 50% of those who have a hip fracture in this elderly stage end up dying, and the other 50% end up most likely being bedridden for their life. So it's really, really important that we can make strong bones their whole life and continue that through this stage of their life. Another thing is their change of appetite. They're not as hungry, so it's harder to get them to eat. They lose their sense of smell. So if you think about how invigorating food smells when we eat it, that's half of our enjoyment out of the food. So this population can lose that desire to eat because of their loss of taste, their loss of appetite, their loss of smell. So we have to work very closely to ensure that there's adequate nutritional intake, and we need to find other means of providing that if that client or that patient can no longer chew their food as well because maybe they have lost their teeth. Maybe we need to change the texture of their diet, so we puree their food. Maybe we give them some sort of nutrition shake like Boost or Ensure. Those are really, really important because they're complete proteins, they have all their vitamins and minerals, and then they can give that person calories so they don't lose that muscle or go into that sarcopenia. One really important way that us as dietitians can do a complete workup or a complete screening of an elderly population's risk is the mnemonic DETERMINE. So DETERMINE, it will be very important that you know DETERMINE. It will be a short answer essay on your final. So be able to recognize what DETERMINE stands for. So the D is disease. So disease, we're going to assess that patient. Do they currently have diseases? What were their past disease? Did they have heart disease? Did they have cancer? Do they have heart disease? Do they have cancer? So we're really assessing what are they at risk for becoming malnourished, potentially because of a disease. E is for eating poorly. So again, this is so important, so vital. We want them to maintain that muscle mass. So they do have an increased protein need, so we want to make sure that they're meeting their caloric need for the day. If they're eating poorly, then they're going to start wasting and become malnourished. T is for tooth loss or mouth pain. So T is for tooth loss or mouth pain. If they have a difficulty time chewing because they don't have teeth, then we need to talk about a modification for their texture of their diet to make sure that they don't get too tired eating. If they get too tired eating, then they're not going to be meeting their caloric need. E is for economic hardship. So again, economic hardship, we want to make sure that if they don't have adequate money coming in, that we can assist them and make sure that they are provided with their needs that they need met daily. R is reduced social contact. So R is reduced social contact. It's important for this elderly to have that sense of community and be involved socially. We don't want them to be isolated. It's so important for their health and their living to have that social interaction. So they have a lot of programs. The Older American Adults Act implemented some programs where it can be community meals or community exercise, such as Silver Sneakers. I know we talked about that in class. M is for multiple medications. So multiple medications increases somebody's risk to become malnourished. There are a couple medications that either decrease a patient's appetite or it can have some type of food-drug interaction. So what that means, if they're on a blood thinner, maybe they can't have foods that are high in vitamin K. So Coumadin specifically is a vitamin or is a medication that interacts with food that contain vitamin K. So we're looking at your leafy greens, your kale, your spinach. So that can cause problems and can be detrimental. So we want to make sure that we address if they have multiple medications. I is for involuntary weight loss. So involuntary weight loss, this is so important, especially when we're looking at the hospital clinical setting or even a long-term care facility. We never want a patient to be losing weight. If they do, we must make justifications as to why. With involuntary weight loss, a significant weight loss is more than 5% of their body weight in 1 month. You need to know this. So a significant weight loss is more than 5% in 1 month of that person's body weight. So we're addressing this because that most likely means they're burning more calories throughout the day than they're taking in. So that's when it's really important. We need to make sure that their calorie intake is appropriate. N stands for needs assistance in self-care. So N is needs assistance for self-care. So maybe this is they can't get up and go to the bathroom themselves. They can't feed themselves because they don't have that motor skill anymore. So we need to have a babysitter or a caregiver in the room feeding that patient. We need to make sure that we address that. And then finally, E stands for elderly over the age of 80. So E is elderly above that age of 80. They are at an even more increased risk of malnourishment that we want to make sure that we address as dietitians. So when we're doing a screen up on elderly, we want to use this determined mnemonic to really make sure that we're hitting all areas that are related to nutrition and that we can help this client and this population to the best of their ability.